Rachel, Shropshire has been put into Tier 2. That feels a bit unfair, particularly when you live here down in the south of the county. Was it the right decision?
Yeah, I mean, I have to say, I think this is the right decision for Shropshire as a county and areas within Shropshire at the moment, at this point in time. You'll know from the national media that we've been looking, there's a number of basket of indicators, if you like, that they look at in terms of where you should be placed into tiers. The decision was taken at national level using information from SAGE and some of the sort of national information from the Joint Biosecurity Centre, but they use 5 indicators. And we need to take into account all of those indicators. So the case detection rate in all ages and over 60s, the positivity rate, so how many positive cases you get in the population for how many people that go tested, and of course the pressure on the NHS, and all of those are taken into account. And while in Shropshire we are certainly seeing an improvement, I'm really pleased to say we are seeing an improvement in our rates overall and in the over 60s, they are coming down. That has only been relatively recent. And we need to see that sustained decrease. Really, we would just want to get the rates in our population, the circulation of the virus in our population as low as possible.
Okay, thank you for that. That's a really useful background. But how are the medical services coping? Hospital beds, GPs?
What you will see is there is a pressure, particularly within the West Midlands region at the moment, on NHS services, but we are seeing that locally as well. When you see an increase in cases in the way that we had in Shropshire over the last few weeks across the whole of the county, that will then follow 2 or 3 weeks later with an increase in pressure on our NHS services. And remember, obviously, our NHS and local care services have been under significant pressure for the last 9 months. So you do see that delayed impact when you've seen a rise in cases, and we are in that point at the moment where we have got pressure on our NHS locally. We have seen numbers rise. Clearly, as our rates fall, we want to see that impact on our NHS, but it is something that absolutely has to be taken into account.
So that lag point is really quite important, that sort of 3-week lag between what we see in positive tests for COVID-19 and then the pressure on the NHS.
Yeah, absolutely, yeah.
Thank you, Rachel. Obviously, my key area and something I'm very passionate about is mental health, and it's quite obvious that COVID has created extra pressure. We've seen a huge increase in people suffering with mental health issues. How is the council coping with this extra pressure, and are you actually managing to reach the people at risk of not being picked up through the usual channels that we pick these people up through? I mean, there's often a lot of people in isolation. I have a fear that these are being missed. Do the council have a policy in place that will help, find these people that are not picked up through the usual channels?
Yeah. So, I mean, absolutely. As you said, we've been concerned about people's mental health and well-being for some time. COVID has just exacerbated that, if you like, and made it much worse. We were aware of right from the start. I mean, mental health, as you know, is not just an issue for the council to address. It's for the whole kind of health and social care system, and for all of us to be supporting and working around. But very early on, we recognised that we needed we would be a health impact, and we need to put more in place to support people around mental health. So we have put a huge number of additional services support into place for people, and we brought that together and been publicising that a lot to make sure that people are aware of the package and range of support that's available around mental health. I think, and we continue to push that. We put in additional services, some of those online, but some of those, put more practical bereavement support, etc. into place. It's a really, really important area. I, like you, share concerns. We've got to continue to push this out and to make sure we reach people. It's really difficult. And we need to make sure people are coming forward to us, so we need to try as many channels as possible, and again get as many people involved. If people are concerned about their neighbour, then let us know there's services there. So we are continuing to try and reach out in as many ways as possible. As the pandemic grows and it changes, we know that there'll be new people who will be impacted by this, so we do need to just continue to reach out. We are doing, obviously we're trying to do that through social media, but not everybody's on social media. We're trying to do that through our community groups and our networks that are out there, and we've shared that information. We're also we're looking at writing out to everybody, all residents, to try and get that information directly out to households. And as I said, it's about a suite of offers that are available for people, because different things will work for different people. I share your concern. This is obviously a really difficult time for people, and we want to make sure that people know that there is support available. So it's kind of, how can we all do this together as well? We have put services in place, not just the council, partners as well. It is, it's a huge area of response.
Thank you, Rachel. Do you have, so if someone is concerned about their neighbour in particular, it's something you mentioned, or anyone that's suffering from mental health, is there one number that's, I know there's lots of things available, but is there one number that you could give to someone now that, listening to this, that they could possibly telephone if they have got concerns about a neighbour or themselves? I know there's lots of good people out there working to support this,
yes.
But people are often confused by, they just need one number really, because there's so many numbers, isn't it?
Yes.
They often talk to Andy and myself, but it'd be very, very useful if you've got something.
Anyway, yes, we do. So the council has, we've got one web page with all the information on. We've got a separate mental health page, but we do have one number that people can ring through. So that number is 0345 678 9028. So 0345 678 9028, and that's the number that if people want to ring through, then please go through to that and we'll help you enter. And that's also the number for the welfare support. Anything that people's got concerns about, we'll make sure you get into the right service and get the right support.
Thank you, that's helpful.
At the moment, for testing centres, we have to go to Shrewsbury to get a drive-in test. It's a long way from Ludlow. It's a 60-mile round trip, £60 in a taxi. Is that wise? Should we not have more testing locally?
So there's a lot of offers in testing around the county at the moment. First of all, anybody who can't travel is able to get a postal test. So I'd always ask people, if you are unable to travel for any reason, please do ensure that you look for a postal test. We've got a number of sites, static sites around the county. So we have a site in Shrewsbury, which is a local testing site, open extended hours 8 till 8. But we also have a centre that's opened in Oswestry as well, which is the same, so those extended hours. We do have a mobile site that moves around the county, and it's mobile as it says, so we do move that round, based in different parts of the county, sometimes in Whitchurch in the north, Market Drayton, with Craven Arms, and we are looking at all sites at all different times. So we are actually looking at a site in Ludlow at the moment. We obviously have to move that around based on need. But we do have those options available, and of course to local residents you can use, there's no borders here, so you can use sites in other counties surrounding, and I would encourage people to do that. But obviously, as I said, there is the postal testing as well as the mobile, as well as the larger testing sites that people can get to and is available.
Thank you.
On Friday, the banner headline on the front page of the Shropshire Star said, "We want Tier 1 for Christmas." Is that likely?
Well, again, the processes are being set out nationally. I've explained those kind of criteria that have been assessed. That will be assessed, we understand, on the 16th of December is the next time that it will be reviewed. It'll be reviewed every 2 weeks. I think I know how hard everybody's been working. I know how hard everybody's sacrificed. If our rates continue to move in the right direction, if we continue, when we meet all of those criteria, then at that point they will look at moving us into the tiers. But I can't tell you, predict the future where we're going to be. But we are at the moment going in the right direction. But I think the important thing for me is we remember what we're trying to do with all of these restrictions. It's not about trying to make people. It's not about trying to be difficult. It's not. I know, as I've said, I know how much everybody's sacrificing. It's trying to minimise the number of people that you're in contact with to reduce that kind of spread of infection, and that's what all of these restrictions are about. And the lower, in my view, the lower we can get that before Christmas, and we know what the restrictions are for Christmas now. When we can go into Christmas with that infection rate as low as possible, that reduces the likelihood that we're going to spread this. And I think that's what we've got to remember. And when we look at the rule of 6, or we look at what that means, it's still trying to keep your distance from people, because what we're still trying to do is avoid that spread and keep that infection rate low and keep everybody safe. My view is that I just want to get to that vaccine, get us through into next year, take as many people as we can with us, keep well, keep safe. we've done the hardest bit of this now. We kind of, I keep saying it, but we're kind of on that home straight. But we've got through this. Let's keep everybody well, get through it, and come out and smile the side of this.
Thank you, Rachel.
Thank you.